Diabetes is a medical condition that develops when your body cannot regulate the level of glucose sugar in the blood. As a result, your blood sugar levels become higher than normal. When blood glucose climbs too high, this affects the cells and tissues of your body. As a result, you can have uncomfortable symptoms such as fatigue, blurry vision, or extreme thirst. But that's not all. Over time, unstable blood glucose can lead to serious and harmful complications. Glucose is made by the liver. Glucose is also made in the gut by the breakdown of carbohydrates from food and drinks. In response to glucose, the pancreas makes and releases insulin. Glucose and insulin flow throughout the bloodstream to all the parts of the body. Insulin attaches to cells throughout the body, which open channels that allow glucose to move from the bloodstream into the cells. The cells in the body use glucose for energy. Without a trigger by insulin, the channels remain closed, and glucose is unable to enter the cells. This causes glucose levels in the body to become elevated. Types of diabetes. Type 1 diabetes. Type 1 diabetes occurs when the immune system mistakenly attacks the pancreas, damaging it so that it can no longer make insulin. Without any insulin, the glucose level in the body becomes elevated. Type 2 diabetes. Type 2 diabetes occurs when the body becomes unable to use the insulin you make. The pancreas is then unable to make enough insulin to overcome the resistance. Without adequate insulin to overcome this resistance, the glucose level in the body becomes elevated. This is the most common type of diabetes. It can often be managed with healthy eating, exercise, and prescription medicine pills. Some people may also need insulin injections to manage the disease. Prediabetes. Prediabetes occurs when blood glucose levels are higher than normal, but not high enough to be diagnosed as diabetes. Gestational diabetes. Gestational diabetes, also known as GDM, is high blood glucose that first shows up during pregnancy. GDM occurs when the body becomes resistant. Glucose value in range less than 100, less than 140, less than 5.7. Prediabetes 100 to 125. 140 minus 199. 5.7 to 6.4. Diabetes 126 or higher. 200 or higher. Risk factors: smoking, unhealthy eating, prediabetes, older age, overweight or obese, physical inactivity, family history of diabetes, gestational diabetes or had a baby that weighed more than 9 pounds, history of heart disease, high blood pressure, high density lipoprotein HDL, cholesterol less than or equal to 35, triglyceride level greater than or equal to 250, polycystic ovarian syndrome. 1. Eat healthy food, add more protein. Exercise offers important benefits, lowers fasting blood glucose and improves insulin action, lowers blood pressure, lowers cholesterol and triglyceride blood fat levels, lowers your risk for heart disease and stroke, relieves stress and can improve your mood, burns calories, which can help you manage your weight, improves energy and ability to concentrate, helps you sleep better at night. Recording your blood glucose levels. Ask your care team when and how often to check your blood glucose. Record your results in a logbook, such as the example below. Logbooks can also be kept on a mobile app or done online. Keeping track of your food and activities can help you to understand how they. What is the C? The AXE glycohemoglobin test measures the amount of glucose that is attached to the hemoglobin in your red blood cells. This test reflects the average blood glucose in your body over the last 2 to 3 months. The higher the C, the more glucose is attached to your hemoglobin. Insulin. Insulin is a hormone made in the pancreas. Insulin plays a key role in managing blood glucose by helping move glucose out of the bloodstream and into your cells. Insulin and other hormones help keep blood glucose levels in the goal range. Hyperglycemia. High blood glucose. Hyperglycemia means that your blood glucose is too high. Very high glucose levels can be dangerous. Causes of hyperglycemia: eating too much food, especially too many carbohydrates, taking less diabetes medicine than you need, inactivity, too little exercise, not taking diabetes medicine as directed, side effects of other medicine you may be taking, infection, injury, or illness, such as a cold or flu, emotional stress, progression of diabetes. Symptoms of hyperglycemia: increased thirst, frequent urination, blurry vision, dry skin, hunger, weight loss, fatigue and/or drowsiness, slow healing of wounds, urinary tract infections, sexual dysfunction, numbness or tingling in feet or toe. Hypoglycemia, low blood glucose. When your blood glucose drops lower than goal, usually below 70 milligrams, this is hypoglycemia. Some diabetes medicines are more likely to cause hypoglycemia than others. Check with your healthcare provider if your medicine may cause hypoglycemia. Check